Hello, today we're going to talk about Gymnema. Gymnema or Gymnema sylvestre. It's controlling sugar cravings. What is Gymnema? What's it used for? And does it work? We're going to talk about all of those in just a minute, but first a brief introduction. I'm Dr. Ford Brewer, F-O-R-D-B-R-E-W-E-R, with PrevMed, heart attack, stroke, cancer, disability, Alzheimer prevention. Excuse me. A little bit of coughing today. Gymnema is a plant. This is a picture. It's a climbing vine found in West Africa, native to Sri Lanka and India. The leaf, although there's a fruit called miracle fruit, the herb is made from the leaf. Actually, I've already covered a few of the details here. It's also known as the Australian cow plant and a couple of other names. Again, the herb is the crushed leaf. The fruit is known as miracle fruit. It's best known for its suppressing the sweet sensation of sugar on the tongue. The active ingredient is called germarin or germarin, and the plant is as I said, a climbing vine. Now, from the Ayurvedics use this for what, 600 BC or more or earlier. The major uses had to do with diabetes, high blood sugar, because it lowers blood sugar. Also, obviously, if you're not able to, if you don't want to ingest or if you can't absorb sugar, you're going to get into the hormonal functions. You're going to get into maybe a low carb kind of diet. Again, that assumes you're also cutting your grain carbs. It also has a laxative and diuretic effect. And I'll talk about the mechanism on how it does that in just a minute. But first, again, always a nod to the biochemistry geeks. This is the chemical, germarin, the molecular structure. Now, always a little bit of academic medical research. This article I found in the Journal of Clinical Biochemistry and Nutrition, Gymnema sylvestre by Kanekar and Singhal and Kamat, again, evidently Indian authors. So here's a few things about Gymnema. Molecular actions, mechanisms, blocks blood sugar. It blocks it's therefore used again with diabetes and diabetes-related diseases. It blocks the receptors, the sweet and sugar receptors on the tongue. It blocks the sugar receptors in the small intestine. And it does this again by germarin, which is a 35 amino acid peptide. There's some suggestion and thought that maybe it also increases insulin secretion and maybe even increases islet cell regeneration. I am skeptical of those last two items. I do think there would have been significantly greater reaction and research and pharma development of this had that been found to be true. Comment about safety. Again, hypoglycemia, especially if you're taking other hypoglycemic medications like insulin or the biguanides like metformin, again, any Saxenda, liraglutide. There's also a laxative effect, and the laxative effect appears to be due to that blocking of the sugar receptors. So you actually get continued defecation of sugars. So you have sugars creating an osmotic effect in the colon, increasing the fluid buildup, and again, laxative impact. Some diuretic impact. Didn't talk a whole lot about that, so didn't really get into the mechanism of it. And as with many medications and over-the-counters and supplements, not so clear about the impact on pregnancy. So again, this was on Gymnema sylvestre, a very popular supplement used in dieting, weight loss, used with diabetes, has been used for thousands of years. Now, again, I usually get a lot of passionate response when I do a video on supplements like this, and I know this is a popular supplement. So, again, let me know if you've had experience with it. Let me know what you think about Gymnema sylvestre. Good, bad, or indifferent, and let me know if you have corrections or more to add regarding the video. Thank you for your interest.